Okay. This meeting is officially called to order. It is the 19th of December, 2024. It is 2:05 p.m.
Perfect. Okay, thank you, Tasha. Look at our co-chairs in action. Okay, and Hannah Sloan, would you like to offer the land acknowledgement?
Yeah, thank you. Before we begin, we acknowledge that we are gathered on the traditional and unceded territory of the Lummi, Nooksack, Samish, and Semiahmoo people who have cared for and tended this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We begin this effort to acknowledge what has been buried by honoring the truth. We pay respect to their elders past and present. Please take a moment to consider the many legacies of violence, displacement, migration, and settlement that bring us together here today. And please join us in uncovering such truths at any and all public events.
Thank you. Always good to hear that out loud. Right, let's move on then. I'm going to go through the agenda. So we're going to do quick moment of introductions, maybe for anybody who is new to the group, might be nice. And then we're going to do a review of the role of the JPOP committee. And that's important just because we're a new committee, and it's really important to clarify our role in this whole big justice project ecosystem. So we're going to spend a minute on that. Then I'm pleased to introduce Julia Garrett of Village Reach, who is going to be helping the community with developing an evaluation plan, and we're part of that process. So we'll have just a few minutes with Julia. And then we're going to look at the one-year progress report, which was really gives you a sense of what we've got so far in terms of moving towards the goals and projects in the implementation plan. And we're going to have an open discussion then with this whole group. I'd love to, just invite that this is an opportunity for everybody to share what they are seeing as the highlights, and then we'll talk about what success would look like looking ahead. Then we have two other items. One is to develop this 2025 action plan for our committee. And so we got a draft in the packet for you if you want to. Hopefully you've had time to read that in advance, but if not, Marty's going to go through it, and then we'll just talk about, like, does it make sense? What questions do people have? Just making sure this is reflective of what people understand to be the priorities for our work. And then lastly, we're going to finalize the committee's rules of procedure, which has been I have to say, the funnest part of our committee work so far, is we've had to really just establish those core documents of our process. So hopefully this will be the last section of that, and it should be pretty simple. And then talk about next steps and have our time for closing, or for the public comment at the end. So any questions about the agenda today? Okay, hearing none. Then let's just do a quick round of introductions. So I'm going to go through the list. It's going to be quick, so I'm going to ask you all to take your mute button off. So wait for your name. And also, I don't know if everybody's is the same, but if you look at the participants list, you can kind of see everybody's name, and I'm going to call you at least in the order that I see you. So you can just say your name and kind of what position you have or what organization you're from. And yeah, anything you want to share about how you're doing in a minute would be great. So Tasha, go ahead.
Tasha, and I'm with Lyndon PD, and I am co-chair of the committee.
Great. And Trevor.
Trevor Aerts, behavioral health specialist, working independently as part of an associates in mental health, and pretty solid week so far.
Awesome, thank you. Amber.
Amber Rucker, and substance use disorder professional.
Thank you. Arlene.
Well, I'm on the behavioral health committee, and it's my second term. And yeah, that's in brief. Yeah.
Glad you're here. Yeah, Arlene's been here since the beginning. She she went through all this stuff through the whole process when the needs assessment on. So glad you're still, yeah, with us in the room. And Barry,
Yeah, hi, everybody. Barry Buchanan. I'm Chair of the Whatcom County Council.
awesome. Glad you're here. Dan Hamill.
Yeah, Dan Hamill. Good afternoon, everyone. Dan Hamill, Bellingham City Council President and Co-Chair of the Behavioral Health Committee for the Task Force.
Fantastic. And folks, after you've introduced yourself, you can remute if you like. And Hannah Sloan.
Hannah Sloan, co-chair of the JPOP committee and clinical program director for Lifeline Connections, and oversee the jail behavioral health and reentry program.
Thank you. Jason.
Hello, Jason Corneliuson. I work in the mayor's office with the city of Bellingham, and I am the strategic initiatives manager for Health and Human Services.
Fantastic. Thank you. Mary Lou.
Mary Lou Stewart, City of Blaine, and I'm the small city rep on the committee.
Great. Glad you're here. Okay, Stark.
Stark Follis, Whatcom County Public Defender.
Thank you. Stephen. Mr. Gockley.
Co-chair
Okay.
of the Task Force's Behavioral Health Committee with Councilmember Hamill, and I'm part of the Justice Project Planning Team.
Wonderful. Stephen, your volume's really low to my
Okay.
ear. Great. Okay. Andrew.
I'm the court services manager at the Bellingham Municipal Court.
Fantastic. Thank you. All right. And
Andrew, are you sitting in for your own interest, or are you a proxy for someone today?
I'm sitting in for Tammy Bennett, the administrator here.
Okay, thank you.
thanks. And in fact, when you introduce yourself, that would be helpful if you just clarified if you're a proxy for another standing member or more an observer role. That'd be great. Okay, Tank, you're up.
Donnell Tanksley, the sheriff of Whatcom County. And, you know, as I look at these different faces, I see that I'm not the only one that have multiple meetings on multiple days. So.
Well, I hope this is going to be the funnest one, Tank. Great. Okay, Dale, you're up.
Yes, Dale Clark, director at Turner and Townsend Hearing. And I'm
what?
an observer, and I'm an observer. I'm with Turner and Townsend Hearing.
Turner and Townsend. And what is Turner and Townsend?
We're owners' representatives.
Oh, got it. For the facilities project, yeah?
Correct.
Ah, great. So glad you made it. Good. Do you want to actually, would you take just like 2 minutes just to say what you're doing? Because you're a new player on this scene.
Oh, yeah, I'm not sure that's appropriate.
Okay.
We are right now in a selection process, and I don't know. South Paul, what do you think?
Yeah, I was a little bit surprised about that. I think Barry is right. We can maybe have more information at the next meeting in January.
Thank you for that clarification. So glad you're here, and we'll wait then on anything else. All right, Dean White, you're up.
I'm Dean White, and I'm a special project manager with the Health and Community Services Department, and I'm the liaison with Village Reach for their project.
Wonderful. Thank you. Eric.
Eric Sigmar, Chief Criminal Deputy Prosecutor with the Whatcom County Prosecutor's Office, and I'm not actually sure if I'm a proxy.
Okay, thank you. Erica.
Hi, Erica Lautenbach, Director of Whatcom County Health and Community Services, and I'm here as an observer today as my boss, the executive, is in his role as a member.
Fantastic. Glad you're here. All right, we have somebody marked as guest. Do you want to introduce yourself?
I have you called Pamela Khan?
Not yet.
Okay.
Pamela, is that you marked in as guest right now?
I don't think I'm signed in as guest. My name shows on the view that I see.
Okay.
Do you see my name?
I didn't a second. Oh, there you are. Yeah, up there. And now guest looks like disappeared. Okay, I saw you kind of coming in and out for a sec though, so it's just probably related to that. Okay, thank you. Glad you're here. And
and
tell us
I'm
what
the
go ahead.
supportive housing subject matter expert on the JPOP.
Great, thank you. And Iris.
Hi, I'm Iris Knott. I'm the legislative policy analyst for the city of Bellingham, and I am an observer today.
Wonderful, thank you. Julia.
Hi all. I'll also be introducing myself a little bit later, but I'm Julia Garrett, working with Village Reach, as Holly mentioned, the performance measurement plan for the Justice Project.
Great, thanks. And just to let you know, also yours sounds a little bit low, Julia.
Okay, I'll try and address that.
No worries. Kelsey, you're up.
Kelsey Peranto with Whatcom County Health and Community Services. I'm here as an observer today.
Fantastic. Thank you. And Roman, you're in. You want to introduce yourself?
Hey, good afternoon. Roman Swanisett, Nooksack Tribal Police Department. I'm the lieutenant here, and I'm also a council member for Nooksack Tribal Tribe as well too. Thank you guys for having me.
Great, glad you're here. Miriam?
Hi everyone, my name is Miriam Karamoko. I am with the Whatcom Racial Equity Commission.
Wonderful. Scott?
Scott Rickman, Bellingham Fire Department, Division Chief of Emergency Medical Services, here representing Fire and EMS.
Fantastic, thank you. And then I see here the Whatcom County Public Defender's Office at the bottom. Who's there in that position?
We have Stark.
Is there somebody else on that? Okay. Then just scanning. I think the other person who popped in, Heather. Do you want to introduce yourself?
Hi, everybody. Heather Flaherty, and I'm here as the co-chair of the Incarceration Prevention and Reduction Task Force. And I also serve in the community as the executive director of the Chuckanut Health Foundation.
Great, thank you. All right, is there anybody in the conference room today? All right.
I don't know who
Satpal, I
the
don't think I got you, Satpal, did I? I don't think I did.
Well, I'm Satpal Sidhu, Whatcom County Executive.
Glad you're here.
Stark
Okay, is there...
is here.
What?
Stark.
Yeah, I'm not sure who the other one would be. It could be just some kind of a double login thing. I don't know. I could leave and come back.
Don't worry, that's okay.
Okay, is there anybody who's here that didn't get a chance to introduce themselves?
Did you do Hannah Fisk?
Oh, Hannah Fisk.
Hi, yeah, I am Hannah. I work on special projects related to behavioral health for Whatcom County Health and Community Services.
Fantastic. Oh, thank you all for coming. It's just really terrific to have everybody here. So everybody's,
Sorry, I just wanted to thank you also and say that I did hear from several people who had things come up and couldn't be here today. And that was just great, the way they sent an email ahead of time. If for members of this committee, it's very helpful to get that communication ahead of time. So in the future, if you can't make it, just let us know. Thanks.
Great. Okay. All right, let's jump in. Thank you, everybody. So Marty, if we could, what we're going to do now is we're going to just do some clarification of the role of the JPOP. Oh, our logistics. Sorry, that's our first thing. Keep your video on as much as possible. Keep yourself muted except when speaking. Remember, these are open public meetings and will be recorded. Whenever we're in an open discussion mode, please use the raise hand button to be recognized to speak. And when using acronyms, please define what they mean. So those are our basic rules of thumb. Next slide. All right, our objectives here are to build some momentum towards our purpose. Again, this is meeting number 3, so we've laid some foundation, and now we're really going to start to get going with our purpose. We're going to begin monitoring progress on the implementation plan projects and defining what success looks like, and begin development of our 2025 action plan. So, right on the ground. The role of the JPOP committee in the context of the IPRTF. So I've been getting some feedback outside of these meetings that it's not 100% clear what we're doing, even though we went through our charter, just seemed like a good thing to restate. So let's start at that little bit higher level about the purpose of the IPRTF and LJC. So the IPRTF is the Incarceration Prevention and Reduction Task Force, and LJC is the Law and Justice Council. So this body has really 2 roles that they play. So established in 2015, not even 10 years ago, the purpose of the Incarceration Prevention and Reduction Task Force is, and it's here's their major roles, is to continually review Whatcom County's criminal justice and behavioral health programs, make specific recommendations to safely and effectively reduce incarceration of individuals struggling with mental illness and chemical dependency, and to minimize jail utilization by pretrial defendants who can be safely released. And the task force also serves as the Law and Justice Council. Okay, so that's their, summary of their overall goal and purpose. So now this evolved a little bit with the passage of Whatcom County Ordinance 2023-039 when council adopted the Justice Project Implementation Plan. So when that happened, the role of the IPRTF evolved. So in the ordinance, the IPRTF was given specific additional responsibilities. And in that same ordinance, the JPOP was also created to really take care of a body of work that it was not realistic for the IPRTF to have to do all by itself, right? That's why you're here, because there's a hunk of work that somebody needed to do. So that's why this got set up. So let's talk about what that is. So when the ordinance went through, the IPRTF LJC got an additional set of responsibilities, which was to monitor the progress on the 15 projects of the implementation plan, to coordinate with the Executive's Office, the Finance and Facility Advisory Board, which was also set up at that same time, right? This other board that's really watching the dollars, and especially related to right now to the jail and behavioral health center. So to do that coordination and others to maximize resources, build capacity, and align plans to accomplish projects. So coordinating with these bodies to align plans and to accomplish projects. And the third major shift was to consult with BIPOC communities, service providers, and people with lived experience about progress on implementation projects and future planning efforts. So you can see how there's this really a significant shift that happened in terms of what the scope of work is for the IPRTF LJC. Okay, next slide. So let's look at how that changed structurally. So the current active committees of the IPRTF LJC are the steering committee, and they're kind of overseeing the overall process. Then we have behavioral health, which is a super big and active committee. The Legal and Justice Committee, also very active. Then we have INDEX, which stands for Information Needs and Data Exchange, and the JPOP, which was added again during this time. That's you guys, Justice Project Oversight and Planning. So these are the committees. Now, a question that has come up is, what is the difference between INDEX and JPOP, because they're both dealing with the question of data and measures. So here's the key difference. Index is working on advising in the development of data collection and reporting systems and making recommendations to assure collection of consistent data across all relevant agencies and departments. So they're really looking at like, how is data being managed, and do we have the systems that are going to make that work? JPOP has a different job, and they do overlap, but it's distinct. So JPOP is monitoring progress towards the goals of the Justice Project Implementation Plan. And they're helping ensure that public engagement and communications are robust to ensure accountability. So again, you can see that at the IPRTF LJC has this broadly, but then they have committees that are carrying the load really and making sure that those specific bodies of work are handled. So does this make sense to folks? I know it's been a little confusing, but I wanted to make sure we took some time to just clarify. Good? Understand? Yes? Thumbs up? Yes? Got it? Makes sense? Okay, awesome. Great, next slide. Okay, so now that we all know where we are and what we're doing, we're going to get to hear from Julia for a minute. And this has got to been one of the longest, like, she's coming, Village Reach is coming, they're coming to help us with this valuation plan. And now they're here and their contract is signed. And I'm so excited to get to introduce to you Julia. So Julia, do you want to say a few words and tell us what you're going to be doing?
Definitely. And how's my audio now, Holly?
Yeah, much better. Thank you.
Great. So as I introduced myself earlier, my name is Julia Garrett. I am a senior manager on the data analytics team at Village Reach. And I'm assuming that for most of you, Village Reach is new to you. And so I wanted to just give a quick kind of introduction to who we are as an organization, and then talk a little bit about, at a very high level, what we are doing with you all. So we are a global public health nonprofit. We have an office here in Seattle, Washington, and we also do other work in other locations. But in Washington State, we are really focused on providing technical assistance to local health jurisdictions such as Whatcom County Health and Community Services. And we really focus on improving health equity and meeting community needs. And in the upper right-hand corner, there's a map there of the state of all of the different kind of counties we've worked in. You'll see that Whatcom is a county we've worked in before. We worked with Whatcom County Health and Community Services on their evaluation of performance management plan for their Healthy Children's Fund. So we're excited to have the opportunity to work in Whatcom again. And at a high level, our areas of expertise span from strategic planning, community engagement, evaluations and assessments, a couple of things around data, both data modernization as well as data analytics and dashboards, and then career development and equity-driven program design. So as you'll see, we have many things related to data as well as evaluations and assessments in there, which tie very closely to what we'll be doing for the Justice Project. And so, like I said, this is super high level, and we'll, as things progress in the new year, we'll get into more detail. But overall, what is Village Reach's role? And it's to develop a performance measurement plan for the Justice Project Implementation Plan that includes and prioritizes information on and analyses of the goals, strategy outcomes, and indicators and performance measures, and really wanting to make sure that those are aligned with the wide variety of stakeholders that we have, as you can see on the call today, and ensuring that your preferences are reflected in how we're measuring the Justice Project Implementation Plan. And then in addition to that, we also will be developing an inventory of existing data sources along with a list of data needs. And so at this point, what can you expect from me, from Village Reach? And the piece that we'll be starting off with is stakeholder consultations. That might be individually, or it might be through focus groups, depending on what we decide will be best for that stakeholder or stakeholders. And as I mentioned, to ensure that perspectives are represented in the materials that we'll develop, and we can make adjustments where necessary. And so now that, as Holly mentioned, our contract is signed, we're hoping to really hit the ground running in 2025, and aiming to begin those consultations in mid to late January. So you'll be hearing from me and or Dean in hopes of scheduling a time when we can connect with some of you who are on this call and or other people who kind of work in the various offices or departments that you're in. And I'm really looking forward to getting to connect kind of more one-on-one or through smaller groups with you all.
Great, thank you. I think also we anticipate that we'll have Julia with the whole group, hopefully, at least in February, possibly in March. So just to let you know, that's our hope, but still to be determined. Okay. So let's move on then. So that's Julia. She's going to be so instrumental to helping us do this work, which is about monitoring progress. And as you may recall, at our last meeting, we talked about the results-based accountability model, which was really about how to think about, population metrics and performance metrics, but we are not going to have that done for a while. So where we have to start with where we're at right now. So where we are right now is we do have some data, but it's not yet organized in a way that's easily shared with the public. What we do have also are the progress reports from the executive's office and an opportunity to help share that information. So that's what we got to start with what we've got and get going on sharing information so that our community is aware of what's going on. That's what we're really looking at today. And eventually, so if you imagine the work of Village Reach and others over this coming year, we are aiming to have a data dashboard. That's one of the major goals in the implementation plan, and it's a major goal for the IPRTF. And Marty, we just went to off of the slideshow and onto your desktop, just so that is the other thing we're going to do is we're getting ready and developing that data dashboard. So the data dashboard, if it's not clear what it is, it's this idea of saying we're going to have these metrics we're going to be watching that are like changes that we are looking to see in the community based on these projects. Like what will that mean for our community? What's important? So we're going to just dip our toe into this conversation today. So next slide. All right. So we're going to start with the year one progress report, which was in your packet. And in a moment, I'll have Marty pop that on the screen. But the first question is to ask all of you guys, what are the highlights so far that you think people would care about? So if we can identify those here with you all, like there's a lot of stuff, but in an age of information overwhelm, what's the stuff that you think is important for our community to know? And I'd love to hear from everybody. What do you think people would care about? And then if you look at it kind of longer term, what would success look like for you? At the end of the day, what are the kinds of things that you're hoping that we will ultimately achieve and see some change over time? So those are the questions we're looking at here for the next, whatever, half hour. And again, I'd love to hear from at least all the, let's start with people who are on the JPOP, and just hear, what your thoughts are. Yeah, thank you, Tasha. Go ahead.
Just looking over the implementation plan that you sent in the packet. What I hear a lot of people are asking is, where are we at with the jail and progress towards building up the jail and the behavioral health center? And then always the next follow-up question is, how much achieved, and are we still on track for how much it was estimated to cost, etc. So.
Yeah, so are we still on track with the dollars that we'd said we were going to devote to that project? Yeah, great. Thank you. So raise your hands, let's jump in. What else? What is important for the community to know, and what do you hope for the long-term kinds of results you'd like to see? Who'd like to go next? Yeah, Dan, thank you.
Yeah, thanks. Good afternoon, everyone. So what I hear from my constituents is wanting some information and accountability on behavioral care center and where in the order of operations does that fall. Knowing full well that the city has made is making investments in the capital components of the jail build, but my constituents want to know about where behavioral health falls into that hierarchy.
And the behavioral care center in particular, or behavioral health more broadly? Dan?
I mean, we could talk about this for hours, but basically the Division Street subject property is I just got out of a meeting with half the people in this call with the response division's conversation regarding how we can convert Division Street Work Center into perhaps a medical facility in conjunction with Ann Deacon, in conjunction with 23-hour behavioral health, in conjunction with Dijwalik mobile medical units. So I think the whole picture would be helpful to the community. It's very complex, but I think folks want to understand the city of Bellingham's contributions in year 5 and 6 when it comes to behavioral health programming dollars as well.
Excellent, thank you. Who was next? Amber.
Hi. So I get lots of questions regarding, the changes that were made to legislation, specifically around the state versus Blake, because as the WAC is written, or the Senate bill, it indicates that in lieu of arrest, individuals should be referred to behavioral health. And it appears that that piece has been dropped, right? People are just not getting arrested. I know that in 2023, they switched it from a misdemeanor to a gross misdemeanor, and that was the change that our state made. But I get a lot of people wondering, so when are we going to implement that behavioral health piece so that we're not having individuals using on the street or in our public without any repercussions? So, yeah.
Fantastic, thank you. Yeah, Erica.
Yeah, I think just for clarification, and I appreciated you going through the roles and responsibilities, but with regard to the behavioral health campus or the therapeutic campus on Division, would that live with JPOP? Would that live with the Behavioral Health Committee of the IPRTF, or both? Just so I am clear about expectations as staff and for our staff.
Good. I wonder does anyone here have an opinion on that to answer Erica's question? Yeah, Dan?
Yeah, thanks, Erica, for bringing that up. Yeah, absolutely. There needs to be clarity on it. Behavioral Health Committee for the task force is a recommendation body only. We can make recommendations, but it's really up to the purview of the county council and the county executive's office to an extent for the county health department to render those decisions. I think that there needs to be clarity when it comes to we can have a wish list for Division, and we can try to decide what the best and most optimal uses are for that subject parcel. However, that's a separate discussion as far as I'm concerned from what JPOP is embarking on here. But it's almost like kind of hand in glove. So I think that needs to get figured out.
Great, thank you.
Yeah, I just wanted to add to what Dan just said, that I think JPOP is part of IPRTF, and JPOP chain of command or reporting goes to IPRTF steering committee or main committee, where different city, county councils people are there. So I think that at this stage of time, let's concentrate on not that what will happen to Division Street campus. That will take time to develop, but I think what we are sharing is a long-term view of that facility, that we have an asset which we can be developed into a bigger asset and focused asset. But I think as far as JPOP is concerned, they should up the chain would be to IPRTF, and health department will deal with behavioral health center and facilities and budgets and where we're gonna get the money from and all this. So that function will stay with health department and through the health department with the executive's office. At least that's what my understanding is.
Right. Thank you, Sopo. Heather.
I would add that if JPOP's focus is monitoring progress on the implementation plan, right, that's a little bit different than the behavioral health subcommittee's more broad policy and advisory focus. So I think that's helpful also, just thinking about there are overlapping goals, but there are different functions of those committees for how we might talk about the work. And I could absolutely foresee a joint meeting specifically on the behavioral care center, or multiple joint meetings even. So I wonder if that's helpful, Holly, thinking about if we're monitoring progress of the implementation of the behavioral care center, that's a little bit different than discussing programmatic policy recommendations.
Thank you. Super helpful. Yes. Hannah?
I think Arlene had her hand raised.
Yes, this may be inappropriate, but I worked in the work center for 9 years. That's a long time. And what I found during that time is that it is a very poor building. It is not built well. It is a pole building, which is made of metal. And it has the air system is very poor, and people were often sick because of it. So you should know that.
Thank you, Arlene. And if we're gonna, kind of change to what we'd like to see, what I would hear from that is the desire for the facilities where people are staying to be healthy facilities.
Yes,
That's what we would want to
for
see.
certain, yeah, but also sturdy.
And sturdy. Mm-hmm.
Mm.
Yeah, great. Thank you. So if you took your hand down, you can pop it back up. So far, what I'm seeing in the queue is Hannah Sloan and then Scott Rickman. So if you got lost in there, go ahead and raise your hand again. But let's hear from Hannah next.
Yeah, I think if we're the committee to be monitoring progress, how do we make sure that the council and the health department are, being held accountable for making these decisions that are recommended, and that changes are made, but maybe half made, or made for a certain length of time and then taken away. So it seems in progress reports, oh, we did this, but then the next year it's not going to be on there. So did we really achieve what we wanted to achieve? Talking about, like, we added new staff and new reentry specialists and mental health specialists for the jail, but then funding is taken away. And so is that not a long-term plan then? And how are we holding each other accountable for that?
Interesting. Yeah, so not just this point of time, but how do we see things over time, that the system itself is sustained, right? Yeah, great. Scott, go ahead.
I think a big part of this, and Dan had said it really well, is getting back to really sussing out what we consider behavioral health and then the substance abuse, where those things bifurcate, because I do think that they're two separate issues that are tightly intertwined, but we can get lost on lumping it into one problem. So, and that we don't get lost just on the opioid crisis, because I think what we're seeing right now in the field is a big evolution away from just opioids, but opioids being in methamphetamines and stimulants and a lot of return of drugs that we've seen in the past. So not getting too hyper focused on a single, alcohol is getting ignored a lot right now too, that we're really talking about the totality of the problem for these folks. And I think the other thing, after being part of that reentry simulation, that we're designing programs that can successfully get people access to integrated resources so we can actually get them back to a successful reentry and we don't see the recidivism that we're currently seeing. Because I think the intent for all of us here is to get those numbers down and to see people successful and not just see that cycle of in and out of jail because we can't help the folks get to where they need to be, do probation the right way. So I think there's a lot of really just boxing, not siloing it, but making sure we have clear ideas of where those areas are and making sure that we have a good plan moving forward for it.
Thank you. Excellent. Yeah, that's really helpful. I bet, Julia, you're taking good notes here. This is a lot of really good content. Thank you. Okay, who's next? So things that jump out at you, and then long-term, what you'd like to see for results. Yeah, Pamela?
Yeah, so I think just what Scott was saying there, I think I'm looking at number 11, bolster reentry support services, and it says that we got a couple of specialists, SUD specialists at or reentry support specialist and a mental health specialist at the jail. So how do we track that, keep that current? Did that serve all that we thought it was going to serve, or how are we measuring once we've put in we've successfully met some kind of goal that we were striving for, but was it enough? Is it serving the purpose we hoped it would serve? So for each and every one of these, I could just and where do I go to learn more about each of these? Expedite access to competency restoration services. I don't know where I need to go to research and see. It says that we've made significant progress this year. So maybe some links or something to help point for me, and maybe nobody else, I don't know. I'm not always sure where to go to further educate myself on what I'm looking at. So easy access for us, and probably that would extend into the community so that the community could take a look at what we're doing and be able to really understand what it is that we've accomplished.
Yeah. So it's it's not just hey, here's a highlight, but here's where to go to actually get more information so you can understand it. And then also the story of well, what change does that matter? Why does it, what's actually happening there?
Right. And did we make the kind of impact we hope to? We need more case management in our community. I'm perfectly aware of that. And being from the supportive housing realm, we've sometimes not housed folks just because there wasn't case management to attach to that. There wasn't a case manager to assign and support that. So how are we evaluating that we have all the right pieces in place? So yay, we have more supportive housing, but or more housing, but do we have the supportive component? And is it effective?
Yeah.
So how are we? And I'm not sure if that's too in the weeds or if that's okay.
Yeah, not at all. Yeah,
I'm learning. Learning. Thank you.
Yeah, of course. And for all of you, it's there's no wrong answers here. We're just beginning to start to really get a sense of, okay, what do we need to pay attention to? What's important? How are we going to know if we make a difference? So, the floor is open to just what's your sense of things? That's what we're here to do, is just start getting our brains around that.
Yeah. That was super helpful, Pamela, in pointing out that just knowing a number of staff increased doesn't tell you if the ratio of staff to people in need has improved for the better. And the ratio would be a lot better metric for us. It's something we really would like to know. And I think that is something that should be available. I would expect that would be available now. Also, much of the kinds of things we want to know, and we're here, it's great to hear it now, because then we can be thinking about how to build data dashboards in the future that that you all think would really inform people about these kinds of questions, what people want to know. So we'll be thinking about those visuals too, like what would be the most interesting thing to find out here? Okay.
Excellent. So I see 4 people in the queue, and then folks who haven't spoken yet. I would love to hear your thoughts too. It'd be nice to hear from as many folks as we can. So Tasha, go ahead.
Well, going over this one through thing, this great handout that you guys have, like the 7 million, one thing that always comes back around is money, and people don't actually understand how budget financing works. A lot of people are like, oh, we'll just cut the budget because we're over budget, or we don't have enough money, and most of it's for salaries, etc., that aren't really that. So like thing number 12, where it says we are recommended for $7 million. Like if that comes into account, how do you distinguish that it can only be spent on that? Because people who don't understand the system might think, well, it can go to this or it can go to that, but it's actually earmarked for some specific. And if it's not spent in that way, it goes away, or we get fined, or et cetera, et cetera. So some of that is just people not understanding how the system works. And then I'd also like to hear from Stark or Eric about, I know there's this thing with the defense attorney's office and then the number of attorneys, et cetera. So I didn't know where we were in that process. So.
Great, thanks. Good. Well, I'd love to hear if those folks would speak up too. So let's hear from Miriam.
Yeah, I wanted to echo what everyone's shared so far, and bringing it back to the point of data. I think since we're measuring progress, I think part of measuring the progress is around quantitative data a lot of the times, and I think we're really missing the qualitative pieces, because when you have percentages and numbers, those percentages and numbers are within a context, and oftentimes we're missing the context. So I would definitely love to see us, I think it would be successful if we had stories along with it, or other ways of capturing, like if you're giving a statistic, then you have a story attached that explains how that all works. It makes it accessible to everyone. It kind of gets people understanding the impact. And I think it's just a great way to portray the impact we're having, is what I heard someone say earlier. How do we make sure we're actually having the impact? And that could be on many different fronts, but this is something I wanted to add.
Yeah, excellent. Yes. Okay, Hannah.
Yeah, I think Miriam really just said a lot of what I wanted to say too, of, like I pulled data for behavioral health in the jail every month, and having those extra reentry specialists especially has been significant in seeing the data grow, and we're serving way more individuals. But then also, how does that connect with the community outcomes that we want to see change, especially knowing that it takes a while for those outcomes to appear. And then I would love to see more qualitative data as well. Stories, we know that it's helping the people, and we know long term that it's going to be helpful for the community, but how do we frame it in a way that the community understands and that the funders understand, so we can continue to do the work in order to see the lasting impact?
Yeah, hear, hear. Thank you. Scott.
I only had one other thing to add, and that was, I think one of the pieces that will be easy to forget as we're planning for any of these things is we're talking about building a building and a lot of other stuff around it, but also protecting the people that are working within those walls and providing resources, not just for the folks that are incarcerated or going through those things, but making sure that we're supporting those folks that are the jailers and all the other folks that are working in there. I think that's something that will easily get kind of forgotten or kind of brushed aside. And as a first responder and talking to a lot of, colleagues in law enforcement and behavioral health and things, that we make sure that we take care of those folks too, and have something. We're only going to be as good as the people working in those walls as well. So making sure that we keep that there as well. So we have those very competent, compassionate people that are working in the system, and that we don't forget about that part of the system, because I think it's just very easy to do.
Yeah, here. Thank you. Amber, you're up.
Hi, I wanted to belly back around because now I see that we're looking at the 1 through 15, and one piece on there, number 9, addresses the youth. And up until this point, I haven't seen anything addressing the youth substance use disorder. And so I feel like we need to, like, is there a way that we're collecting that data? Only ask that because as of right now, there's like 2 inpatients for youth in the state of Washington, and they take like anywhere from 4 to 10 months out. And so those is a huge part of our population that are suffering from the substance use disorder and need us there as well. So just wanted to kind of figure out, are we tracking that data for individuals incarcerated in juvie or in treatment, and what that looks like. So thanks.
Thank you. Great question. Trevor?
It's a little bit of a sidebar kind of additive. The last few folks that spoke kind of spoke generally to what has been on my mind. But when thinking about what would be helpful for the community to know and what success may look like, the thing that stands out to me is sort of how do the data points get created? So most of the folks that I see who have anything to say about the progress that the county's made only have been able to focus on the jail. It's almost like they don't even know what else is being done by the county to try to serve their population. So any way that would be helpful for the under-resourced and for the folks that will most likely be involved in the system to know what is being done to support them on a grander scale, I think would be really helpful. And then the other thing would be kind of like it's a little bit less of a formulated idea, but more of like how do we ensure that people are not only resourced but have access to those resources in a way that meets them where they're at. So that's what success would look like to me, is if I hear more from the community about knowing what the resources are, knowing where to go, and have those resources be available for them when they get there. So that kind of like assuredness that people have in their community, that they have those support systems, I think would be one of the greatest measures of success.
Thank you. I think let's see, Stark, you it was asked that you might reply to a question that was raised earlier. Are you?
Yeah, I wasn't quite sure what Tasha was referring to. Are you talking about the caseload standards? Okay, well, we're in a holding pattern on that right now. The proposed caseload standards, which I've given this spiel to so many people over the last couple of years that, but I don't know that all of you have heard it. The Supreme Court is looking at reducing the maximum number of cases that public defenders, court-appointed lawyers, can accept in a particular period of time, and the proposals that are before the Supreme Court right now would basically roll back defender caseload caps about 70% over 3 years. So if you do the math on that, that's going to have to double to triple the number of defense lawyers that are necessary to deliver the same services that we do presently. And the proposal, in my view, lacks any funding at this point, although there's certainly attempts to get the legislature to take a look at that this next time around. And we also have a severe shortage of attorneys to fill the positions if they were funded. So it's unclear to me whether, if the standards are adopted, they're even possible to achieve. But in any event, the status of them as at present is that the Supreme Court met, their Rules Committee met in December. They didn't really deal with the issue, and they tabled it until February 26th, which is the next time that they will take a look at it. And whether they will vote on the 26th as to adoption of these standards or not, I don't know. you know, and the proposals that are in place now start the implementation in July of this year and run their course over a period of 3 years. You know, I think that affects. I think after the last JPOP meeting, I sent an email to Sat Paul and a couple other people that, you know, I think this question really does affect what the Justice Project looks like, because in the event that the 39 counties cannot accommodate these caseload reductions, I think it's going to affect the ability to prosecute cases, and I think that's going to fall on, you know, Mr. Sigmar here and Mr. Ritchie to figure out what we're going to do with unrepresented people. And certainly programs like diversion or decriminalization or those kinds of things are probably going to have to be facilitated, but whether they can be facilitated to the extent to reduce the numbers of people going through the system by 70%, I rather doubt. You know, but be that as it may, if people can't be prosecuted, they don't find themselves in, you know, in the jail facility, in the behavioral health facility, in the, you know, perhaps even in the LEAD program and programs like that. It's, you know, I think that it's a significant issue in terms of what our project is going to look like 2 or 3 years down the road, you know, if the Supreme Court does adopt these caseload reductions. And this isn't just Whatcom County. I mean, this is all 39 counties, and every municipal court in the state of Washington would be facing these caseload reductions and having a ripple effect on the ability to prosecute those folks in a traditional manner. So does that answer your question, Tasha?
Just trying to think long term, like we're doing short term, but also long term. And I know that I was recognizing that would have a huge impact. But Eric, that has nothing to do with prosecutor caseload, though, right? Correct?
That's right, but it'll limit the amount of cases that we can prosecute, and we'll have to dismiss several cases.
Okay, well, thank you guys for bringing in that context. That's a really, yeah, a really important issue. Thank you for bringing it forward. So I see Hannah and then Dean and then other folks who haven't had a chance to speak yet. Roman, would love to hear from you. And who else is here? And Kelsey and Iris and Frank. I don't think we got to hear from you in introductions. I'm just going through the list, but anyone, we've got about 5 to 10 more minutes on this topic. So yeah, so Hannah, go ahead, and then Dean, and then anybody else who feels moved to speak.
Yeah, real quick, wanted to add on what Amber was saying about the youth. I will also want to be mindful that we're not focusing just on substance use, because that's huge right now. We're also seeing a lot of youth come into detention or being involved in the courts who have really complex issues. And we can't place them anywhere. So we don't have the substance use facilities. We don't have behavioral health facilities for those individuals, and then developmental disabilities. And then when you have them all co-occurring, nobody will take them. So how are we going to serve those youth? And it happens for adults too, but the youth are often left out of those conversations.
Yeah, thank you. Dean?
Just listening to some of the comments about fluctuations in funding, it strikes me that an important set of measures as we look at how to evaluate the impact of all of our efforts is what's the pattern of funding over time? I think needs to be tracked so that, you know, for example, the reentry program, if there's a concern about it not performing at the level we want it to, but the funding's been reduced, we need to have that as a denominator of some kind in the calculation of what our impacts are. Yeah. And I just noticed that Mary Lou had her hand up too, just, you know, not in the machine, but in the human way.
Yeah. Good eye. Great. Mary Lou, do you want to speak?
I just want to, seeing as we're talking about this whole topic about the public defenders, from the small cities, and that's who I represent here, this would be absolutely devastating. We do not have the funds to hire twice as many or 3 times as many defense lawyers for these. And also they want law libraries available to them. We just don't have these funds. We are struggling to keep our police force funded, let alone hiring 3 times as many public defenders. So that is one thing. I mean, a body is placing on the small cities requests or demands that we simply cannot meet. And the only way we can meet them is to suggest to our police force that they only arrest the most serious of crimes. And I don't think the people really want that. They don't want all these other criminals running loose on the streets, because we can't afford to ask our police officers to arrest them because we can't pay for the prosecution of them. So there are so many aspects of this, and people need to look at all aspects before they jump in and make these suggestions. And then you end up backtracking. So instead of jumping forward and throwing these things out, people need to consult and think about all of the problems before you go to the level that this one has gone. Anyway, it will be a problem for our city and for all the small cities, just saying.
Yeah, thank you, Mary Lou. Marty.
I just wanted to make a comment about you related to the comments about youth. And I don't want to at all downplay the significant importance of addressing youth involved with the criminal legal system. However, I just want to clarify that the implementation plan, and therefore our focus, is on adults involved in the criminal legal system. So while it's interesting and informative to bring up youth issues, and we should, maintaining some awareness of that is great and certainly worth comment, we're focused on the adult criminal legal system for this work going forward.
Yeah, thank you for that. Okay, guys, any further comments on things that you think would be important for, highlights that you think would be important for our community to know when you look at this plan? So we can start thinking about also how to get the word out, what's the shape of that. But any other big highlights or thoughts on, what the longer term results you'd like to see? Anybody who didn't get a chance to speak? Yeah, Miriam, go ahead.
I was gonna ask, have we, and I'm still figuring out our role and, all these other really amazing entities doing this work with us. Have we defined who our target populations are? Very, specifically defined them.
Yeah.
I feel like the answer to that lies in the needs assessment document, pretty much, and then the implementation plan. So we have I'm going to just say it very generally, the scope is people who are involved in the criminal legal system, adults who are involved in the criminal legal system or at risk of involvement with the criminal legal system. And it was really helpful to me to work on the sequential intercept model, which was work done by a group called the BEGAT, the Behavioral Health Gap Assessment Team, this little committee that formed that worked on looking at each of the points at which an individual may come into contact with the criminal legal system and seeing what services do we have available and what do we need at that point in the system. So I feel like that work kind of, for me, defined our scope pretty well. And I think that's reiterated in the implementation plan in kind of a summary form. Does that help? All right.
Great. Okay, any other comments before we move on to our plan? Okay, So that was excellent. It makes me feel really optimistic or about our ability to do our work as a group. And, uh, Heather, I was wondering if you wanted to tee up or you don't have to, but just the reason we're doing these action plans and how it fits into the bigger picture of the IPRTF. Do you feel like saying any words on this, or would you like me to take a crack at it?
Was this a question for me, Holly? I'm sorry. To
Yeah,
tee up
no,
the action plan?
yeah, like how we're doing it from the perspective of the IPRTF and your and Peter's leadership there. Do you want to
Sure.
say
I'll
a few?
just say a couple brief things.
Yeah.
I think that there's a real hunger for being able to look back in 12 months or a year and a half and be able to see what actually were the outcomes of our work together. And so there's been an effort in this first year of Peter and my leadership on the task force to help prioritize where do we want to focus. Of course, we want to address all of the issues all of the time, but having a few key areas of focus and prioritization is really helpful for agenda planning. It's helpful for county staff and partnership to see, what is the highest priority and where to send people to what meetings. And I think it will be really nice at the end of the year next year to be able to look back and say, here's what is different or has changed because of our work together. So with that spirit, we've been working with Holly and Marty on having these conversations to help everybody understand what role they're playing in the work. So anything you'd add, Holly?
No, that was fantastic. And I think just for all of you to know that each committee, which we talked about at the top, each committee of the IPRTF and holistically, the IPRTF as a whole is working on what's our plan. Each committee is developing a plan. And the priorities include, for everybody, include the data dashboard and the jail and behavioral care center, and then the what's the last one? I'm just blanking.
Diversion programs.
Thank you. The diversion programs were identified as the three for all of us to be paying attention to. And that worked out great for JPOP. Wasn't a big stretch because because of the public engagement component relative to the jail and behavioral care center, and also because the data dashboard is right in our lane. So that made it kind of easy when we talked to the co-chairs. They're like, I don't think we need to make this more complicated. Like, isn't that what we're doing? It's like, yes, that's what we're doing. So we've come up with this first crack at a action plan that would be for our work, and it would help us really have some focus. So as we look at this, Marty's going to go through it just to make sure everybody understands it. Then we'll hear questions for clarification, and then just straight up feedback, like, does this plan make sense? Of course, it'll change as the year goes along, but does the plan overall make sense for us for how we're going to focus our time together? Okay, so here we go. JPOP Committee Action Plan for 2025. Marty, take it away.
Well, I just want to say at the top, it says here, preliminary draft. This is a draft. And so everything's up for discussion here. Feel free to share your comments. We just needed to get something out there. We thought it would be easier for you to respond to something than to try to come up with an action plan from scratch as a group as large as this. So I'm just going to give a brief overview of it, but mostly want to hear your thoughts and feedback on it. At the very top are the responsibilities of this committee, and summarized here. This is from the charter. And when developing the action plan, we're just trying to make sure that we were doing all of these things, that actions we're taking are related to all of these responsibilities. So serving as a forum for people with lived experience and frontline workers to be engaged and give feedback on key questions through the implementation process. participating in the development of an evaluation plan to measure progress and results, monitoring data to track progress on the implementation plan projects, preparing an annual report. Our report is that then becomes part of the IPRTF's annual report. Providing recommendations for plan updates and ensuring public engagement and communications are robust to facilitate accountability in the plan's implementation. So I hope that you will see that our action items relate to these responsibilities as you look it over. And here we are in this first row. This is today. And I think we are doing these things. So yay, we've got success. We are on track here with our with monitoring progress and starting our work to develop an evaluation plan and developing our action plan. As we go through, well, I'm going to just say one thing about this. The review year one progress report, what you just were looking at and what we were reflecting on in that whole last conversation was it was a summary of quarterly reports that came out through the first year of implementation. We started counting with November 2023 when the ordinance passed, when the sales tax passed, and we went through November 2024. So what you were looking at was a summary of progress over 1 year. Moving forward, what we'll be getting are quarterly progress reports. We're thinking that we would use the same kind of template that you got in your packet. But these reports would be quarterly, and the first quarter is ending, or the fourth quarter of 2024 is ending this month. The report will be produced in January, and we'll talk about it in February. So you'll see that rhythm throughout the plan. Every time there's a quarterly report, we will talk about it the next month after, once we have the material to work with. And that's that we're calling monitoring progress. And so when you see those headers, that's what we're doing there. And I'm gonna just add, as this evaluation planning process goes along, what we are expecting is that you will be getting more real data, like population and performance accountability metrics, not only just process kind of descriptions of how things are moving along on each of the implementation plan projects, but also some data. That's our goal. And in identifying what kind of metrics will be presented, will be pulled from reports and will be gleaned and presented, we'll be working with Village Reach on this performance measurement plan. And we're hoping to, like Holly said, have Julia here February and March. This, and like I said, this is a preliminary draft, so these dates may change, the actions may change. And we'll start providing input on website and data dashboard design, and we will be giving input on planning for public forums, where that's our community engagement piece, our public engagement piece, and we will be providing input on communications. So when, like, not just the website and data dashboard design, but also how does the word get out to people about what's happening with progress on the implementation plan? I think that's a high level overview of this, but I'd like to stop talking and get your feedback after I just point out that these June and July dates are highlighted in yellow here. And that's because they're not the third Thursday, which is what we're aiming for all the other meetings. But we're hoping that this June 26th will work because the third Thursday is Juneteenth, June 19th. And we didn't want to have a meeting on a holiday. And then we wanted to have one summer meeting. So we'll be communicating with you closer to the time about those dates. Okay, I think I'm really now done talking and want to open it up for questions and discussion about this draft here. And if you happen to know of any activities that are going on that are related to our responsibilities, to our project, our kind of focus topics or actions that you think should be included in here, please share that too, so we can try to build it in.
Marty, do you want to just briefly go through the rest of this?
Okay. I think I'll just go right back here and say that we mentioned this before, it's in your agenda, that we're working on survey and focus groups with inmates and designing that along with Caleb Erickson, the chief deputy of corrections, and that will be a tool used and data gathered for the facility design group committee. And we are hoping for your input on that at the next meeting, and we'll have Caleb here to talk with us about the work going on design. That'll be next meeting. The rest is kind of this, I think I said kind of the rhythm of it, talking about the progress and designing the evaluation plan and talking about communications.
Yep.
And public engagement.
Hey, Marty, I think stop for a second, scroll up slightly too. I think another important thing that was recommended for our committee by the IPRTF co-chairs is that we would have a hand in planning reflections on a public forum regarding the jail and behavioral care center design. See that in April, and then there's a second one conceptually planned for later in the year. So that would be, working with the folks who would be designing, the jail and behavioral care center, but that we would have a role in the public engagement on that. So that's later in the year. Can you just scroll down to the last page of the schedule, Marty?
Mm-hmm.
Just to make sure everybody can see that.
Mm-hmm.
So we have the September.
We kind of set this up so we help plan something, and then we come back and we look at what happened.
Yep.
So we help plan the focus groups and survey of people in the jail, and then we'll look at what the data said. We help plan and provide input on a public forum, and then afterward we talk about what happened.
Beautiful. Okay. So.
And we have reporting in here too, which I think I mentioned before, our reports mostly get rolled up into the IPRTF's annual reports.
Fantastic.
So the way we'll do reporting is we'll talk about, hey, everybody, what do we think are the key themes that came out this year? What are the key things that we did? And what do we think are maybe some recommendations that came out of our work? And we'll have those conversations toward when it gets close to reporting periods.
Great. Wonderful. Okay, everybody. So this is the draft action plan for our committee, a rough draft for your feedback. Floor is open. Questions for clarification or, suggestions, things you'd like to, that you think would be helpful for us in achieving what we are set out to do? What's your feedback? Okay, don't everybody talk at once.
I guess I'll just throw out one question, which is, did it make sense to you that this would be our action plan? That these are the kinds of actions we would be taking? Does this seem appropriate or is something missing? Thank you for the thumbs up, Miriam. I love thumbs up. But yeah, if you're have the feeling like, oh, but I thought we were going to be doing XYZ and you're not seeing it here, feel free to mention it. And if you know, I said that, ask this, oh, Dean, you want to say something?
Well, I was just thinking that, a lot of the items that are going to be reviewed and looked at from the standpoint of how are we doing in implementing the various elements of the plan, we'll learn more about what are the resources necessary to implement those plans. And some of that's more just a matter of, updating that initial notion of where the funding would come for the various projects. But I think at some point there may need to be an item that has to do with recommending resources or funding up through the IPRTF and to the county and the executive about, if we're going to do these things, we've got to nail down where the resources will come from to accomplish them. So kind of a budget input step.
That's really great you brought that up, Dean. And making those kind of recommendations is within our purview, especially like we would make recommendations that would go to the IPRTF, and so are all the other committees. And then there are other groups as well that will be thinking about, do we have adequate funding? All these questions you just brought up. Do we have adequate funding to do this work? Where might we get more? What do we do? And putting together recommendations that would go to the county council from the IPRTF and other committees, and to the exec's office. And that's totally in our job as well to think about that. Yeah. We might also, I'm just going to throw this out there. We might also find that one or more projects need an update in their approach. And this, I think the conversation that the information Stark brought to us today, it may be relevant there. Like maybe a particular project, a project related to changes in how people move through the courts needs to be changed in some way. And we may want to say something about that as a group to the IPRTF as we learn more over time.
Thank you.
Tasha and Hannah, if you want to, Holly, you do.
Go ahead, Tasha.
I guess when I'm looking at all these things and all the ideas that we've all been talking about, all the different programs that we are currently funding and we have in progress. I guess to show progress, do we have a base number? Like how many are in leads and how many are in grace and how many people are they serving, and do we have our base? Because we can't make an evaluation if we don't have a base number. And if there's a place where I can find it, I would love to, I know about all these things, but I don't know the specific numbers. Or is that part of that dashboard that we're talking about?
That I would say that ideally we would start with the previous year or years on our dashboard and then be building forward so we could see where we've come from. Yeah, that is important for for context to know where are we?
But is that the index committee? Is that what they're collecting? And if so, have they have it?
Maybe
Where
not
are they?
necessarily the, oh, Erica, do you want to respond to that?
Sure, yeah. So our department collects this. We have a robust data collection system that draws from a number of different sources, including, you know, the EMS system, the 911 dispatch, the jail, etc. And so we present to county council, and I could send you, and I bet Hannah, who is on the call with me, could find it, the evaluation data that we have, which includes not only like number of people served, but reduction in jail bookings, in days in jail, in other negative outcomes, and cost offsets that the program contributes to. So there's a lot of good data already that we can build into the data dashboard that they're suggesting here.
Fantastic.
Erica.
Thank you. Thanks, Erica. Yeah. So, yeah, good to hear. Okay, Hannah, I think you're next, yeah?
So I want to make sure that our action plan is reflective of the IPRTF's action plan, since we're all about monitoring the progress of the task force and the implementation plan all as a whole. And then also, I know that Heather mentioned wanting to focus on a few of the projects for the next 12 months or so, but also what kind of work is being done on the other projects, if any, and how do we also continue to monitor that, even though they're not necessarily a focus.
I want to just make one comment on that. And we thought about building this preliminary action plan, focusing only on the 3 priorities that the IPRTF has selected. But this group's purview really is all 15 projects. And so I think, and the IPRTF and other committees are also focusing on all of the projects. It's just in terms of, you know, it is helpful to know where there's the most energy and desire to focus first for the committees, and like Holly said, our focus on the evaluation plan on data and data dashboards is perfectly aligned right now. But that does not mean that we're not going to be looking at all of the 15 projects, right? And that's same with the rest of the IPRTF committees as well.
I think by virtue of our work on the data dashboard and being able to monitor progress, we're going to be looking at all 15. I think it comes with the territory. And we may want to dig, what I'm hearing from this is we may want to dig deeper into certain areas, right? Looking at that data and hearing even from any of you, like, I'd like to, you know, think about this or talk about this. So I would say that if you are feeling that and you know, to let me or Marty or our co-chairs know, I'd really like to build some time in for this, you should let us know. Because we can, you know, we're at a point in the game where we are building out our calendar. So yeah, give that some thought for what you think would be meaningful conversations. Dean, you're up.
I really appreciated Tasha's mention of the need for base numbers or baseline data. And one of the things that I think the Health and Community Services Department has been working on is sort of using a logic model approach to all of the various activities and programs that it engages in, which means that you're measuring, you know, inputs and the processes that one goes through in the various efforts, as well as the sort of the outputs, the activity and the people served, as well as the outcomes and impact. And so it might be worth thinking about organizing, you know, our base data from which we measure results in all of those arenas. And again, the inputs goes to the question of What funding or resources have we made available historically, and how has that changed over time? And how is it changing as we go forward?
Yeah, here. Great. Okay, gang. So this, if you have any other thoughts about this action plan, like I said, go ahead and share your thoughts with me or Marty or our co-chairs, and we'll just keep on building these things as we go. It's pretty open right now, like it has a basic structure, but plenty of room for adjustments. So yeah, thanks to Marty and thanks to our co-chairs for helping kind of figure out how to approach this. And I have to say, we're going to be trendsetters for the rest of the committees because we're first getting it done. So we're already winning.
Yay.
Hey.
Good job, everybody. And thank you for your feedback today.
Yeah, really excellent. Okay, we have a couple more things to do today. So let's go to the next item. We have one little piece left, which is the approval of the committee's rule of procedure. And if you remember at our last meeting, we had this conversation and it got really kind of complicated. So we have really one thing to vote on, and I just want to quickly review how we do our vote. So, I'll lay out what it is, and then from the floor, a motion and a second happen first. Then we discuss, and if people have any friendly amendments, they go ahead and offer those. And then we call for a vote on the final recommendation. So it's not strict Robert's rules. It's a blend of consensus. So after we kind of figure out if there's a change, we call for a vote, simple majority vote to pass, and unresolved concerns are left on the record. So we do a roll call vote of just the members, and they're declared proxies are eligible to vote. And when we call for the vote, it's yes, no, and abstain. So I'm not going to go through this with us every time, and we actually don't have to do a lot of voting, but we do on these things because they become, our formal documents. And this one's pretty simple. So basically, what happened here is when we did the draft rules of procedure with the expectations for advisory group members is actually, it's a document that was put by, just exactly as it's written into our rules of procedure. And we had attempted to clarify some of those expectations for advisory group members. And that's where we all got like, wow, it got really complicated. So the proposal is basically that we do not attempt to clarify the original language, just leave it as is. The expectations is its own document. We leave it as is and not try and make things more complicated for ourselves. So to do that, we would make this adjustment. We would just say exactly this language and then just add as follows. So it's just, this is the document. So as follows, and that we would delete the note at the bottom, which said to clarify, because when we got into that clarification is when, if it just didn't feel like it was a good use of our time in a nutshell.
It
So
didn't
that
make clearer.
yeah, it didn't make it clear. So that is the proposal. The proposal is just to use the word as follows, because the expectations are right in there exactly, and then not attempt to clarify. So if we could go back to the slide before, and just that the proposal is do not attempt to clarify the original language provided in the expectation process. So what I'd love to do is hear if I have a motion and a second from the floor, and then we'll go ahead and open the floor for discussion. So yeah, that's Tank asking to get back in. Great. So can I hear a motion from the floor, please?
I'll make a motion.
Great. So Tasha's made. Barry?
I'll second it, and I'd like to kick off discussion.
Go ahead.
I do have one question on the note that you have at the bottom of the page. When you talk about proxies only being allowed if they're in the enabling statute, it might be good to clarify what the statute says about this group in particular, so we know what the proxy situation is? Do we know? I mean, we should.
Yeah. We could put the link to the statute in there, if that would be helpful. That was one idea. And also that there was not anything necessarily very clear about in the statute about appointing proxies.
Okay.
So I think I'm hearing Marty. Could you go to the next slide, please, Marty? Is just to put that we just have a link on that.
Oops, sorry. I was gonna try and pull up the language, but
as by statute. Barry, do you think that that would be adequate for now? Is if we just link it to the statute?
Probably. I just think we need clarity so people understand. I mean, that's a pretty important issue, because whether we can or can't have proxies. So we need to definitely clarify that somehow. I get your point in not wanting to paraphrase in any way the original memo that goes out for the expectations, but I do think we need to know, and everyone needs to be clear on what the proxy process is.
Okay. Good. So supporting this basic proposal, but also looking forward to having some other piece that we would develop to clarify proxies. Yep. Check. Other points, other discussion.
Would you like me to just, while you move on, I can pull up the language that we wrote that did do that, which we decided to not include, and we could run that by people?
I don't think that would be helpful right now because we already found that that didn't work for us. So I
No.
think we should, if
It wasn't shown, the language, that language was not shown to this group.
I'll take a look at it and bring a recommendation back next meeting.
Okay.
Great. Thank you, Barry. Okay, any other discussion? Okay, so is everybody clear on what we're doing here? We're trying to get through the changes to the rules of procedure. Yeah, Roman, go ahead.
So is this just to remove the bottom small print on the Justice Oversight Committee rules and procedures to clarify members can designate proxies for meeting they will miss, but cannot establish permanent proxies without formal approval and replacement?
Yep.
I'm just trying to catch up here. Sorry, guys.
Yep.
You got it.
You got it exactly. And that Barry would go ahead and look at that and come up with some other recommendation for us for how to address proxies as a separate issue. Okay, further discussion? Okay, we have a motion second. We've had some discussion. Marty, I neglected to put up the form that had the list of the JPOP members. Do you have that handy?
I do, yeah.
Can you call them?
I could go through and call names and then mark what you say.
Okay, so everybody, this is the moment where you can take your mute off if you're a member of the JPOP. Marty's going to call out loud for you, and we're going to move through this. Vote as you see fit. Yeah, a yay, a nay, or an abstain.
Wow, we have some difficulty. That's better. Okay, Trevor?
Yes.
Thank you. Barry?
Yes, it's hard to hear with all that extracurricular sound going on.
Okay, maybe we're going to have everybody just turn their.
I think everybody should mute, and you could just hit your space bar and it will take you off mute for a second, and when you let go of the space bar, it'll put you back on mute.
Okay, I'm muting you all right now. So just unmute and then remute. And you can use your space bar, as Barry mentioned. So go ahead,
I
Marty,
got
let's continue then with
Heather.
the. Mhm.
Heather is the next one. And if you see that Heather's not on, I can't see who's on actually at the
It's
same
on,
time.
but her camera's on.
Okay, we'll come back to Heather. Stark,
Yes.
okay. Daniel, Dan Hamill. Is he still here? Okay. Pamela. See if I can get a list. Nope, I cannot see a list at this time. Okay, so Pamela's still here, right? Pamela, can you unmute?
Okay, sorry, I tried the space bar. Apparently it did not work.
Oh, okay. Are you a yay or a nay or an abstain?
I am a yay.
Yay. Okay. All right. Pamela, Miriam.
Yay.
Jason. I think Jason isn't on. Okay. Eric Sigmar. I'm also not seeing. And Amber.
Yes.
Great. Scott.
Yes.
Paul.
Yes.
Hannah Sloan.
Yes.
Mary Lou.
Yes.
Roman.
Yes.
Donnell Tanksley. Still on?
Yes.
Oh, good. Thank you. Tasha.
Yeah.
I think I heard a yes. Okay, and I'm going back up. Heather, are you able to respond? Okay. We'll Heather, if you want to vote on this, just interrupt as we go along and we'll get your vote in. How about that? All right, we did it. So that was unanimous based on the folks who were here who represented a quorum. So I think we are good with the rules, and we will send out a revised and final copy to you.
Yeah, before we stop, are there people, I think Trevor, did you vote?
You did.
Did. Okay. Is there anybody who knows they are a JPOP member who didn't vote? Okay. Great. We did it. Yay. Okay. Last but not least, we are going to now talk about what happens at our next meeting. Yeah. We have that.
Just a sec. Be right there. Okay. There we are.
Go ahead, Marty.
This is what I mentioned when we were going through the action plan, that we're going to learn about ideas for the jail design and behavioral care center design, and discuss questions to use for focus groups and a survey with jail inmates in order to inform that facility design. And I'll just note that the jail and behavioral care center design is one of the top priorities areas for the IPRTF. So this shows another way that we are overlapping and in sync with those top 3 priority areas. and also doing work that's really a great fit for this committee, because I think you're going to have some really good input on this. Paul?
Yeah, I just wanted to clarify something when we say jail behavioral care center design. What we are really looking for are the features, not like design, okay, 400 square feet of this. And I think what would really inform us or the people who are involved with this action is that, is there any special purpose spaces you would want to have, any special purpose services you would like to see, what features these two buildings should have. I think we need to get those ideas so that then we have a litany of things that community and public prefer to have in these two facilities, jails, as well as the behavioral care center. And then that would allow us to do the inform and inform the design people, and then match with the how much money we have. So I mean, ultimately, we can have a lot of wishes, a lot of things. I just want to caution everybody that we would like to accommodate maximum things that we can, but our limitation is going to be the budget. So keep that in mind. But we would welcome all new ideas from different angles that what this jail and behavioral health center should feature. Thank you.
Thank you, Paul. That's really helpful clarification. And I just want to add that we're not going to be starting totally from scratch. Before the group or during the next meeting, we'll show an example of a facility that's really inspired thinking of the folks on the jail and behavioral care center design team, and also share out a preliminary wish list that kind of describes the general kinds of features and feeling of the facility that we already know the group has been inspired to try to emulate. So Tank?
Yeah, so I won't be at that meeting in January due to training. I will have a proxy. However, I want everyone to also keep in mind too that as we talk about building the new Justice Center and the Behavioral Care Center, that we also have to think about the sheriff's office in general, because once a jail is built and we have the Behavioral Care Center, we still have to have a space for the actual sheriff's office. And hopefully the idea is to provide that space within that same footprint on the bounty. So again, I have a proxy at that meeting, but also, just keep in mind that we have to have a new space for the jail. Although that's a different pot of money and we're not even there yet, but I just want people to keep that in mind. Thank you.
Great. Thank you so much, Tank. Okay. Well, we're nearing the end of our time together, and it's been really a rich meeting. Is there any other hands? Okay. So good. Well, I want to open the floor then for public comment, and then as time allows, we can have other just folks sharing kind of closing thoughts. So for those of you who are not on the task or on the JPOP, is this a good time if you had thoughts you'd like to share, or anybody else? We're all in one meeting here, so what are your thoughts, any reflections that you'd like to share at this time? Tasha?
I don't mean to put you on the spot, Frank, but I saw that you logged in, and I know that we had discussed that you'd be great input because of the great role that you play. And so I just kind of wanted to say thanks for joining us, Frank, and maybe give him a moment to have him ask questions, or if he has any things that he'd want to be put forth, because he came in just
A little late. Yeah, Frank, I noticed that too. Frank, it would be lovely to have any, and Marty, we could take down the screen maybe and just, Frank, no pressure here, but is there anything you'd like to share?
No, just at this stage, how I arrived here. I'm here as a representative, but I also have my professional capacity working in the juvenile justice system. And so I just hope, I just hope that I'll be able to be a resource to this, from, again, my professional lived experience, and as well as from the standpoint of an advocate for affected populations of people.
Awesome. So glad you're here. Really, yeah, thank you for coming. And hope you can keep coming back. That's really spot on. Okay, other folks who would like to share, Kelsey or Iris? Trying to look at other folks who haven't yet spoken. If you would like to jump in. Or Andrew.
Stephen or
Stephen.
Anna Fisk.
Okay, anybody else?
Can I just ask a clarifying question? I'm sorry, I know everybody's trying to get out of here. Marty, you indicated that this was absolutely an adult population that we're working with. However, it was listed as number 9. So I guess I just wanted clarification as to why the youth was disclosed in the packet on 9 for the youth inpatient. And then, so that's kind of what prompted me to bring it up. And then you kind of was like, nah, we're not doing anything with youth. So I guess if you had any.
That wasn't, so the place that this report that we looked at came from is from it's a report produced by the executive's office every quarter. And that is a group that is a regional, that project number 9 comes from a regional group that is looking at what are the needs for additional facilities, and that is where they're finding a big need. So seemed worth reporting. And it doesn't mean we won't track along with so then what happened, So then were they able to get state funding? Are we able to work together as a region to really try to do something regarding a youth facility? So Paul, you have more to add to that?
I just wanted to, for benefit of everybody. So we have a Swiss organization that's a Skagit, Whatcom Islands, San Juan, and Snohomish. So 5 counties, we got together more than 2 years ago, and we are looking at regional priorities, and behavioral health is one of them, transportation and broadband. So we picked 3 major items which are common to all these 5 counties. And that way we can access all the elected people from these 5 counties rather than talking to just our elected officials only. So that is just for imagine that competency restoration hearings or Western State Hospital number of beds, right? That is something impacts all the way from here to Seattle or Everett. So So there is another conversations going on, and we wanted to be informed through this mechanism so that people know there is another layer which is being discussed. So that's where that information comes from.
Thank you. Great, super helpful. Yeah, and Amber, to your point, I'm hearing that there is just a lot of, in this room, there is a lot of interest and concern about youth. So I just want to hold that that's also here in the room, and that it's part of this bigger picture as Sapal just described. Yeah, Hannah?
I'm also wondering, if we do focus on adults, what do we see as the benefit for having a youth representative that we still need to fill that spot? Yeah, just putting that out there. And then also, if anybody could point us to where it says it in the implementation plan that it's just adults. I'm only seeing stuff that says individuals and not necessarily dividing it by age. So I could just be missing something.
Great question. Okay.
We'll send that out.
All right, everybody. Well, thank you so much. This was just, you're just an amazing group of people, and it's an honor to get to spend time with you. And I hope you all have a really happy holiday. And yeah, we'll see you in the new year. Good job.
Thank you.
Bye.